BBC Radio Merseyside.
It's 7 o'clock. I'm Phil Cooper. A Liverpool MP says the closure of a hospice inpatient unit in the south of the city has already resulted in terminally ill people dying in hospital and settings that aren't appropriate. Curie closed its 26-bed ward in Woolton last July and claimed at the time there was a shortage of specialist staff. Yesterday, the charity confirmed the facility won't reopen, but now says it's because of funding problems. The Labour MP for Garston, Maria Eagle, says she's appalled at the situation.
If people want to die at home and it's possible, then it's good that can be supported, but that isn't everybody. And we know while the inpatient beds have been closed, more people from South Liverpool have been dying in hospitals in settings that aren't as appropriate. And so I was very keen to get these inpatient beds reopened.
Campaigners who've tried to save the inpatient unit from closing have called for another provider to be brought in and say they'll fight to ensure the building isn't sold off. Marie Curie Chief Executive Matthew Reid insists they'll continue to provide community services from their base in Woolton.
We have no intention of closing the hospice or of selling it. But that, even if we did, that would not produce the running costs, which are the most expensive thing. So hospice care, we often talk about beds. A bed isn't really a physical thing. A bed is a staff team. And the challenge is not having enough resource to pay for staff teams to run in an inpatient unit.
A few minutes of the show, we're going to be having more on the story. We've covered a lot here on breakfast. The Marie Curie Hospice in South Liverpool, which is to close permanently. Curie Hospice in South Liverpool this morning. After months of campaigning, it's been announced the inpatient unit in Woolton will close. The charity says the local integrated care board, which buys NHS services in the area, couldn't provide long-term funding to keep the ward going. Now, I know many of you have had loved ones who've experienced end-of-life care there. I have as well. My mum's auntie did. My nan, she experienced end-of-life care there. You've called the show in the past to tell us about what it means to you. And one of those callers is Clare, beloved. And we've had Clare on lots of times. She's a friend of the show now. And her wife, Sandra, died at the hospice in 2021.
And now for us, it's about fighting for this building in Woolton that's been a hospice since the 1950s to be given back to the people of Merseyside so we can use it as a hospice still, an inpatient hospice care.
The people who are out here with you, many of them have either worked in there or have had loved ones like you have who have passed away in there. So it's a really intimate relationship you have with both the building and many of the workers in there. You know them. They've seen you through your worst moments.
Yeah, and a little old man came as we were standing here outside with the staff, and he comes here every week because his wife died here 10 years ago, and he comes to the building, and it means so much. It's a sacred place for us, for the people of Merseyside. Our loved ones spent their last moments here. There's ashes here. So hundreds and hundreds of families and individuals on Merseyside have been deprived of the chance of a good death here at the hospice over the year where it could have been opened. And we offered to fundraise whatever was needed for this hospice to be open over last year, and we were told no amount of money will help you get this open. We promised the staff and the people of Merseyside that we won't stop till we can secure this building for the people of Merseyside. And we're asking people in Merseyside to now take us seriously and support us in this campaign.
And that inpatient unit does mean so much to the people across Merseyside, doesn't it? That was Clare Beloved there, whose wife Sandra died at the hospice back in 2021. We're going to hear more from Clare after 9. But Matthew Reid is the chief executive of Marie Curie, and he told our reporter Mark Geyer that there's no way that they can overcome the financial challenges to keep the inpatient unit open.
The challenge around the inpatient unit is that the amount of money available in Marie Curie and the amount of money available from the NHS, the amount of money Marie Curie fundraises locally, together that is not enough money to sustainably fund these beds in the future. And that's why we've had to make the very, very difficult decision to permanently close the inpatient unit.
But the question some people ask is, during this 12 months when you closed the unit, was that they're saying you've had £2 million from the Integrated Care Board, which buys the services for the NHS. Was that not used? Could it not been used? And also, fundraisers, the campaigners said they were happy to try and raise you more money. The way this city saved Zoe's Place Hospice, they could have done the same for this had you given them a chance. Why did you not explore with them ways of raising more money?
So the money we get from the NHS in Liverpool is used to run the service we run at the moment, and we've been working with the Integrated Care Board all through this period, the NHS, and actually we're going to continue to, we've both committed to work with each other into the future as well. So the money the Integrated Care Board, the NHS, has available and Marie Curie has available, collectively we'll put that together and see what we can do to ensure that the maximum number of people have good end-of-life care across the board. That's our priority.
But you weren't prepared, or were you not think it was realistic to engage with the people, to say, okay, see how much you can raise, we'll give it another year perhaps, maybe they can come up with the £1 million, 2 million you might need?
So the people of Liverpool are extremely generous, and they give us almost £1 million a year at Marie Curie, but it costs us nearly £4 million a year fundraised income to run the Marie Curie services. But also, Marie Curie is running a deficit. We're spending more than we earn as an organisation every year, and the NHS Liverpool also has a deficit, and both organisations have to reduce those deficits.
This is a valuable plot of land in South Liverpool, and I think you've got very expensive or headquarters in London, which are in a good position where you could raise a lot of money. Could you not have sold either and moved to less auspicious areas and perhaps raise more money to keep these services going?
Well, we're keeping the hospice open, so the hospice will continue here in Woolton Village to run our outpatient services and our community-based services to other services across the northwest of England. So we have no intention of closing the hospice or of selling it. So hospice care, we often talk about beds. A bed isn't really a physical thing. A bed is a staff team, and the challenge is not having enough resource to pay for staff teams to run in an inpatient unit.
Do you accept, though, that home care is not always the best option?
Yes. For many people, good end-of-life care can be very well delivered in people's homes, and many people choose that.
But
for other
they might need to come here.
Yeah, for other people, that's not the right place. It is absolutely a need for inpatient beds across Liverpool. We believe that at Marie Curie. The question isn't about are beds needed. The question is about how they're funded. And there isn't enough money in Liverpool from Marie Curie or from the NHS to fund the beds on this side. We will continue to work with the university hospitals as well, and also with the other hospices across the city to make sure that people who do need inpatient care can get it.
Campaigners say that you haven't been transparent through this process, that it was always the plan to keep this unit closed, and that the whole consultation period was you just strung them along till you made this announcement.
Marie Curie has been very proud to deliver inpatient care to many people across the city for many years, and we believe that inpatient care is required. It has now become clear that there is not enough money from Marie Curie or from the NHS to fund those beds, and we've made a decision, therefore, as quickly as we can. Now we know that information.
In your lapel, you're wearing the daffodil, the logo, the very famous logo of Marie Curie. There's a Marie Curie shop just the other side of the lights from here. One person outside said that she volunteered in that shop, and about 2 months ago she left because she wasn't happy with what was going to be happening here. And what do you say to all the people who raise money for Marie Curie, either donate to your shops, buy from your shops, might go on sponsored events, when they see, well, we're raising all this money, but a much loved and much needed, in their opinion, facility is being closed? Why should I give to Marie Curie and maybe find another hospice somewhere else?
We're going to carry on supporting people across Liverpool. We desperately need that fundraising to continue. Without it, the number of services across Liverpool is likely to reduce further. So our message to fundraisers is thank you very much indeed for all you've done. We need you to carry on fundraising and supporting Marie Curie's work. We fully understand that people feel very, very disappointed that we're not able to reopen the inpatient unit at the hospice, and we're very concerned about our staff. We understand the fundraisers find this very difficult news as well.
That was Matthew Reid, Chief Executive of Marie Curie Charity, speaking to our reporter Mark Geyer. And we have had a statement from NHS Cheshire and Merseyside, which says that the organisation has been working with Marie Curie. Unfortunately, these efforts have not resulted in a sustainable long-term solution, either for NHS Cheshire and Merseyside, Marie Curie or local patients. And we have now confirmed that we will instead work with wider health and care partners, as well as Marie Curie, to develop and agree a new clinical model, including the provision of inpatient beds. If you want to chime in on this, joining us, we've been talking a lot about this morning on the show, and not just this morning, to be honest. This is a story that we've covered quite a lot. I'm talking about the Marie Curie Hospice in Liverpool, and we're talking about it because of the permanent closure of its inpatient unit in Woolton. It's been closed since last July, and the charity says that the local integrated care board, which buys NHS services in the area, couldn't provide long-term funding to keep the ward going. Now, I know many of you have had loved ones who've experienced end-of-life care there. You know, I shared that, my mum's auntie did. My nan, she spent her last days there in the inpatient ward in Marie Curie in Woolton. And you've called up the show to tell us what it means to you. I'm joined now by Clare, beloved. Clare's wife, Sandra, died at the hospice in 2021. And they raised thousands of pounds for Marie Curie. So, Clare, good morning.
Good morning.
Thanks for coming in.
Thank you.
How are you?
We're all very low today, but determined to fight on.
Yeah, absolutely. And I'm talking about fighting on. Let's just take it back for anyone that's not heard you before, who's not as up to speed with what's going on, who's woke up this morning hearing the news that the inpatient ward will not be reopened. Let's just take it back a little bit to how you got involved for fighting for this ward to remain open.
Yeah, because a lot of people are just saying, oh, it's the government and we need to fundraise now to get it open. So, and they're also saying, oh, why are you speaking out against the charity, and questioning us. So, I am still in grief a lot after the death of my wife. I'm just trying to get on with my life, really, and try to make it as best as I can. And I got a phone call out of the blue 6 months ago from Councillor Lucy Williams and some of the staff from Marie Curie to say, Claire, will you go on the television and speak out, because we can't speak out because we're frightened about our jobs. This is the staff. Mm-hmm. But it's been closed for 6 months and they're not telling anyone. Marie Curie aren't telling anyone. So I said, of course, I'll do anything I can to get it open again. And then after I'd done the TV piece, other families started ringing me. Tess, whose daughter had died, Mo, whose husband had died in there. And we kind of all supported each other and formed like a community action group. And at first, we didn't want to do this. We just wanted to be getting on with our lives. So at first, I went into Marie Curie and spoke to the chief executive. And I had a big open heart. I went to him and said, how much do you need? The mums, nans, wives, kids of Merseyside will raise that for you, like Zoe's place.
Absolutely.
But after that meeting with Matthew Reid, I knew there was no chance the wards would ever be open again by the way he spoke to me. And what he said, that no amount of funding would persuade him to open up again. And from there, we have been kind of trying to uncover what's happened, whose fault it is, where's the money. And it's not a fight we wanted to be in. It's every time we step into it, it's very upsetting.
Yeah.
But I have to say that it's great to hear Maria speaking out this morning, because we've been crying out for 6 months for someone to speak the truth about what's happening. And it's really good to now hear voices joining ours, because as a bereaved person, and you're very involved, there's ashes at the hospice, the staff you all know and love, it's really hard to keep stepping in and fighting a big charity with a big PR department who have been, I would say, bullying us as bereaved families in the way they've been with us.
And when you mentioned Maria there, of course you mean Maria Eagles, the Labour MP for Gost. And we heard from Maria earlier on in the 8 o'clock hour. If anyone missed it, you can go back onto BBC Sounds just after 8 o'clock. We heard from Maria Eagle, who said that she is pretty disgusted with how this has turned out. What's the feeling today with the other people that you've campaigned with?
Yeah, so we've got a group and we talk to each other and support each other. We have to step in and out a lot because it just brings up so much grief for us. And we're a great support for each other. But we've been disgusted, outraged and shocked with Marie Curie, the charity, the head office in London, for 6 months. So now we need other people to speak out, because what people have been saying to us, other councillors, the ICB, is yes, you are right. Yes, where has that money gone? But we cannot speak out about a big charity because it's not popular. So we have been left to do that. So now we need people in power to also speak out, because it's always left to people who are the most vulnerable to be courageous, but now we need others to speak out.
And I mean, I know you've used the word bullying there, Claire, you know, that's how you've felt about this. And, you know, we have had a statement from NHS Cheshire and Merseyside, with, you know, which says, you know, the organisation has been working with Marie Curie. Unfortunately, these efforts have not resulted in a sustainable long-term solution. Marie Curie said its board of trustees took the difficult decision after the Cheshire and Merseyside Integrated Care Board, which commissions end-of-life care, confirmed it could not provide sustainable long-term funding about existing arrangements. Mr. Reid, who you mentioned, said the hospice would continue to provide end-of-life care through its home service, which they were looking to expand, and other services. So, I mean, that's what they've said on that. Yeah. I'm just going to park here for one sec. We're going to go and have a little bit of travel with Helen, because I want to hear more about Sandra.
Total Sport. Every weeknight from 6 this summer. Join us for Total Sport Mers.
Another one, but 5-10 minutes with Duncan dissuaded me. I had to do it.
I'm joined with Beloved now, and we're talking about the recent news that the inpatient part of the Marie Curie Hospice in Liverpool will not be reopening. Claire unfortunately lost her wife Sandra, who died at the hospice back in 2021, and Claire joins me now. Claire, we've just been chatting there before the travel. So just tell us, I know it's a bit of a sore point. I know you've come in here this morning, you're really disappointed, you're upset, you're angry. It's brought a lot of emotions up for you throughout this whole fight that you've been on. But just remind us how Marie Curie helped your wife Sandra and gave her what she needed at the end of her life.
Great, I will do, because there's nothing I like better than talking about Sandra. You know, people think people in grief don't want to talk about their loved ones, it'll upset them, but actually we love to do that. I just wanted to respond to two things that we spoke about earlier, because I think it's really important. One is that we've met with the ICB, and people are under the impression that the ward relies on donations to Marie Curie relies on donations to function, but they are actually given big contracts by the NHS, and they have had 2 million for the last year from the ICB when it's been closed. So that is just something that people are confused about, so just wanted to clear that up. Sandra Richardson was an amazing woman. She did amazing things for the community in Bootle, set up the first lesbian and gay youth group in Bootle. She then went to Knowsley and helped build an amazing big youth centre there, a real community person who believed in community assets and looking after people, and people were always put first. And she ended her life, she was a chief executive of Knowsley Youth Service, and she always put people and the community first. So when I want to give up this struggle and think it's too much, I think about Sandra, and she's behind me going, keep going, girl. But what Sandra loved about the hospice was the staff, and yesterday we stood outside and we looked after the staff as they came out after being told the news, and we hugged them, and they all said, Sandra would be so proud of you standing here, and Sandra is going to look after us. And it's so, and the journalist said, how come they're saying that? It was 4 years ago. I said, because everyone they look after is a part of their family. It's a vocation.
Absolutely.
And some of them have been there 30, 40 years.
Wow.
And so to see them in bits yesterday saying we have been betrayed by Marie Curie, and we've just been given a half-hour Zoom call where we've been told the news and given 30 days, and to see them heartbroken, and it was so good to be there for them. So yeah, and we fear now that land will be sold off. Now Marie Curie have said no, but Marie Curie said no, the ward won't be closed permanently. So we are calling for everyone to stand behind us. Our loved ones' ashes are on that land. There is a 27-bed unit there that can be used, that could be used for this community. So, and people did donate buy a brick to buy the building.
Yeah.
The nurses tell a story of a man who came in with like thousands and thousands of pounds in envelopes and said, this is for the new building.
Wow.
Years ago. And we've all given thousands of pounds to that building. So why not do the right thing, Marie Curie, and hand that building over? Because there's nothing like Scousers to go, right, let's get that sorted. What do we need in that ward? How many nurses? Okay. Mm-hmm. Let's get that. Do we need a fundraising campaign? Let's do it.
Yeah.
But right now, I don't think there's many people on Merseyside who are happy giving to that charity, given what they've just done to the city.
Well, a lot of people did get in touch with us the last time we had you on, saying that they were disappointed, and that's how they felt. We mentioned earlier with our Labour MP Maria Eagle, she's disgusted. It doesn't sound like it is the end of that. I'm sure lots of people are thinking that this morning. One thing I will say is, the minute that you talked about Sandra, this is a sad day, your face just lit up. It really did light up. And, keep talking about it and keep doing all those wonderful things. And she is there by your side, because they don't ever leave us. And, just to remind everyone listening, Clare, who I'm talking to at the moment, you campaigned with many others for the reopening of Marie Curie's inpatient unit. Sadly, that's not come off. The Board of Trustees at Marie Curie said they took the difficult decision to do this, but you're going to carry on, aren't you?
Yeah, you can't come up from London, from your plush offices and your big salaries, and tell us that we're losing something so important to us. The fight goes on, but we need now politicians, MPs, members of the council, the ICB to speak out about this and to get that building back for the people of Merseyside where it belongs.
Like they say, Claire, if you want something doing, ask a woman, but if you want something really doing, ask a Scouse woman.
Who's a Scouse mum, a Scouse nan, or a Scouse lesbian?
Absolutely, absolutely. Well, listen, what I'm getting from our conversation today is that, this isn't just about the money now. What I can hear you calling for today is, you want people, you want voices in power to get behind you on this, to carry on the fight for yourself, for Sandra, for all of those other people that, use the inpatient part of the unit at the hospice, that lost family, that were part of this fight with you, for the staff, and
especially the staff. We're really thinking about them today. They've been texting me all through the night. Claire, we can't sleep, we're devastated. Those staff deserve our love, and they've helped us in our worst hour. They need us now.
Well, you can hear your love for them today. So, Claire, thank you so much for coming in. Thank you very much. That was Claire, beloved.